Hello, lovelies, and welcome to this week's episode of Get Your Sparkle On. I'm super excited to be joined by Dr. Bethany Rossington from Renavé Clinic in Retford. Thank you so much for joining me and taking time out of your busy schedule.
Thank you so much for having me. I'm so excited to do this. I know when we met a little while ago, we discussed doing it, and I'm really excited to actually be here, being able to chat with you, and I'll definitely be trying to sneak in some tips from you as well.
I think we both just message each other constantly questions, hence why we ended up having a conversation now for our podcast and our listeners. So obviously I know a lot about you, but can you just tell us a bit about yourself and how you transitioned from like dentistry into the aesthetic medicine?
Yeah, absolutely. So, as you said, my background was as a dentist, and as soon as I qualified, I'd always wanted to be a dentist. I went into general practice to do the year, which you do to get your kind of NHS number, so you can work on the NHS. And while I was at university, my mum experienced a horrific dog bite on her face, and it was always kind of in the back of my mind how that had impacted her confidence. And I then went into a maxillofacial surgery job. So that was treating facial trauma and injuries, for example, from dog bite injuries. And I became really interested in the psychology as well of patients when they had changes in their face. I really loved the medicine side as well. So I was really enjoying that job, but it didn't really fit with the work-life balance that I was looking to have because my husband's job is quite flexible. He works long hours, but he is more in control of those. So when I was kind of reassessing, I really didn't want to walk away from that sense of helping people and making them feel really good. So I actually ended up doing a life coaching certification in 2017. And I was really desperate to find ways to help empower other people, make them feel good. And I thought, well, if I'm not going to stay in the surgical pathway, what am I going to do? And the penny sort of dropped that actually I've always been quite entrepreneurial. I've always, had the tuck shop at my brother's football club, so selling sweets and cups of tea on the sidelines. I would go to car boot sales and buy clothes and then sell them on eBay for more. So I've always been really interested in business as well. So it suddenly occurred to me when we were away with family, actually, I could tie in making people feel really good, still using my medical background, because I think that's one of my strengths in what I do is my experience clinically with running my own business. And it just took off from there, really. I did a 2 year aesthetics training program. And the more I did and the more people I impacted with it, the more passionate I became. Because I thought, actually, I mainly see woman after woman coming in saying, oh, since you did that little bit of filler for me, I've gone to the gym and lost 2 stone, and because it just made me feel like me again. Or since you did that, helped me treat that scar, I've been going dating again. So it's really just I've become more passionate the more years I do the job. So that was how I kind of transitioned across.
That makes perfect sense because I know you love enhancing natural beauty and making people feel good. How do you balance that with clients' expectations, with obviously the world that we live in these days? Like, for example, I just come in and said, I think my lips are thin. I want you to put filler in. And you went, no. Not in a bad way. Not in a bad way.
The thing is, I don't follow trends, and because why would you want your face to go out of date? And all treatments come with risk. And although we can minimize them as much as possible, we do have to think carefully about what treatments we're going to do. And we don't just I just don't want my patients to look the best on the day I treat them. And I'm sure you have the same considerations when you're planning or doing eyebrows or lips, for example, with colors and styles. You think, okay, but how's this going to look in a year? Because I could do something great today, an amazing before and after for Instagram that's going to get me loads of, loads of engagement. But how's that going to look in 5 years? How is it going to look in 10? How can we maintain this? So if patients come in with unrealistic expectations, I'll generally try and get to the bottom of the why, what's making them want that, exaggerated enhancement, what's making them ask for this treatment. And a lot of the time it's actually just down to education. So maybe a misunderstanding where they think, oh, well, someone told me if I do X, I'll get Y. And actually, when I educate them, we realize it wasn't even maybe the right thing for them, and they're grateful for that conversation. So education is a huge part of my system. We'll spend an hour doing a consultation, and that really allows us to get to know each other, understand exactly your why, what you're wanting to get out of your treatment, not just expecting patients to come in, say they want a treatment, just have it and not think
Yeah.
about them again. I really get involved in the mindset and the long-term journey.
100%. And that's why I loved our consultation, because things I just heard and saw and I thought I needed because everybody else was having it. I came in with a certain mindset and came out feeling refreshed and heard. And yeah, it was just absolutely amazing, my consultation. We'll talk about obviously what treatments I've had beforehand. A lot of people worry, don't they, about Botox and aesthetic treatments, that they look going to look scary, because unfortunately we do have lots of social media out there that portray filler as an awful look,
Yeah.
blown up lips, trendy, frozen, angry looking eyebrows. So that's the one thing that I absolutely love about you, is it is all natural. So what I wanted to ask is people worry about when you should actually start having it done. And obviously part of this conversation today is I want people to understand that it is natural, and people can just talk about what they want and have the voices heard. But when would you think about having permanent fillers and aesthetic treatments and things like that? When should you start? What sort of age do you think you should start at?
Yeah, funny
Ish.
when you said when you should you start having permanent makeup, I was going to be like right
Yeah,
now. I
permanent makeup. Yeah, no, permanent makeup. I went into my permanent makeup spiel there. You can tell I've been working hard all day. So when should you have, obviously, your Botox and fillers, and when should you start considering it? What sort of age or time of your life should you think about having it done?
So if it's the right practitioner, when something bothers you, that's the time to go for a consultation. And then the clinician can advise you based on what you're presenting with, how to get the results you want. Because I'll see a lot of young girls coming in saying, oh, I want to have Botox. And I'll say, okay, well, why? Let's talk about why. Oh, well, my friends are having it. I'm like, okay, but why do you want it for your face? And when they say, okay, because I don't want wrinkles, I'll explain that actually their skin is like a Marks and Spencer's non-iron shirt, and it's bouncy. If they make a crease in their skin, it bounces straight back. So relaxing that muscle with Botox, that's what Botox is. It's a brand name for a botulinum toxin that relaxes the muscle. So when we inject it, the muscle gets relaxed. It then wears off after a few months. So it's a bit like putting on a raincoat and not going out in the rain. If you've not got that skin, the lines aren't sticking around. Some people would disagree and they would champion this preventative Botox, whereas for me, I champion preventative skin treatment, which is different. So if you're in your 20s, you really need to be prioritizing that hydration of your skin, not damaging your skin barrier by overusing acids, retinol, because when people think your skin's like a sponge when actually it's a barrier. And if we damage that, that's when we start to see breakout, sensitivity, redness, dermatitis. So in your 20s, prevention is key, but with your SPF, your hydration, you could consider treatments like microneedling. Late 20s, maybe look at Profilo as well, which stimulates your collagen. They're your preventative treatments. Botox is like the iron. So when your skin becomes more like linen, we can iron it, but as soon as you fold those creases again, they're going to stick around. So the priority really is not the Botox Band-Aid, it's the skin quality. Botox has a really good place in stopping you creasing the muscle, but only as your skin starts to see those static lines stick around.
I absolutely love that about you. And you explained that to me on my consultation, because you do just get hooked on Botox fillers, Botox fillers, Botox fillers. And the fact that you've explained that in such a simple way, hopefully people will know that there's so many different other things available out there other than the Botox and fillers. And them analogies are just so simple and easy. They are perfect analogies of younger skin to slightly more mature skin. So thank you for that. It's really, really, really good of you. So obviously, just while we're touching on that, I know there's lots of trendy TikToks and Instagram posts, and you're like me, we don't tend to obviously follow those things, but we're aware of them. So if I'm okay, to ask you, what are your thoughts on like exaggerated lip enhancements and things like when you see people dissolving them for fun? I will tell you the truth, it freaks me out. I have clients coming to me who've had their lips tattooed, they've gone and had lip filler, and then they've just had it dissolved for the laugh, not for a medical reason. They've just decided, oh, I just didn't want it and have it dissolved. And when I'm tattooing them, it's like going over I can't explain it. It's soft, then hard, then soft, then hard. And it's just so hard for me to work over. Is there any hints and tips you can give on
Yeah, totally.
where's this come from, this dissolving?
So fillers in this country are mainly made of hyaluronic acid, which we find naturally in the body, but we can link it together in a gel so that we can inject it and it stays roughly where we put it. Dissolving agent is an enzyme that snips those bonds away. So it breaks it down and your body can clear it away. And we naturally have that in our bodies. The dissolving agent is found naturally in the body. So when you have filler, that's why it doesn't last forever, because your body starts to break it down. But we can inject a concentrated form of that that's going to break down that filler quicker. Now, there are risks involved with dissolving, such as allergic reaction. You could get swelling and it could become quite inflamed after you have that dissolving. So it's quite common to see significant swelling afterwards. The reason you'll be feeling those bumps is because either the product that's been used to fill the lips isn't a dissolvable filler, so they might have had a permanent filler placed, then a semi-permanent filler placed, and then tried to dissolve it. So there's still some residual product. Or they've just not dissolved it fully, in which case you're just feeling a bit of filler, a bit of missing filler, a bit of filler. Now, when you dissolve filler, it doesn't dissolve away your face or break down your natural tissues. It can reduce your natural hyaluronic acid. I can't get to say that word today. Hyaluronic acid, but your body will replenish it within 24 hours. So that's not really a concern. So dissolving, if somebody's got unaesthetic work that they want to reverse, can be a great option. And if I see patients with, really big lips or migration of the filler and they want to get rid of it, I'll often say, look, we're not refilling your lips without dissolving first because we want to get rid of any bad work and put good work there. We're not going to put good work on bad work. That being said, the right product in the right place very rarely needs to be dissolved, very, very rarely. So I've dissolved in the years I've been treating patients. One of my own patients, I've had to use some dissolving agent and filler because there was a little lump in the lip, and that patient was my mum. And so, of course, it was. And there was a little tiny lump in her lip, and you could just see it when she smiled. So I said, like, let's dissolve that bit. But in all the years I've been practicing, I've never had to dissolve someone's treatment because they don't like how it looks or because it doesn't look good. So really, you need to be going to a clinician who, if you look at their before and afters, you're happy with the results. They're using premium quality fillers that are dissolvable, but that are going to they're formulated in a way that means they're going to stay for long enough that you get the benefits, and don't have treatments just planning to dissolve them, because any clinician who's just filling, dissolving isn't really taking your well-being seriously.
Yeah, perfect. I 100% agree with it. We've talked lots about industry standards and safety. So obviously it's really hard especially for us too, because we have clients traveling from all over. I know you have a lot of clients from London coming to see you. So what should people look for when they're choosing an aesthetic practitioner, for example, if they can't come to see you, what should they be looking for?
That's a really great question because I'm sure you think about this often with your clients. What message do we want to put out there to help people know we're the right clinician for them? So I would say I believe that you should either be a doctor, dentist, nurse, or prescribing pharmacist really to be doing treatments. So somebody who has a medical background with experience of diagnosis, of prescribing, of injectable, of complications management. And this isn't just a case of I've gone on a course that has taught me complications management. I mean, firsthand, real medical experience, because what you do throughout any of those kind of degrees or qualifications is much deeper than what you can learn on a few days or a week's course. Now, for example, I recently had a therapist working here, and for me to be allowed to send her on a chemical peel course, she had to have an NVQ level 3 or above in beauty. And there are certain treatments that I can't do because I don't have a beauty qualification. So if I wanted to do those, I would go and do that qualification. So I have nothing against anybody going and doing that nursing degree. If they want to do aesthetics, go do that nursing degree from any background. Go get your prescriber's qualification, because if you believe you've got all those skills and you can do it anyway, then it's straightforward for you to get that qualification. So, and it's not a non-medic bashing. I think there's a bit of a thing about whether it's trying to steal all the patients for ourselves as medics. Like, there's plenty of patients for everybody.
Yeah.
It's a safety issue. And I think one of the issues is that I'm sure there are some exceptional non-medical clinicians. And there are a few which I've even come across where you think their knowledge is outstanding. However, that's not as a stand, it doesn't come as standard. So how can that be regulated or how can it be assured? Because yeah, there's some rubbish medics doing
Yeah,
aesthetics. There's some
yeah.
unscrupulous dentists, there's some, so it's more that at least you will have got a minimum standard. Whereas if you can do just go and inject your friends with no training, how do you really know what you don't know? Almost, at least if you've done the medical training, we know for sure you've got just that basic standard of training.
Yeah, 100% agree. It's like
I
me,
think that's
I'm
that.
qualified in permanent makeup. I'm not going to then all of a sudden just go do a quick course to learn Botox and fillers. Yeah, technically I could do that. It just doesn't sit well with me. Yes, I've just done a few little short courses to enhance things I already do, but they're short courses. I've already got the fundamentals of your anatomy and physiology and the level 4 and all the years and years of experience of working on people's face. So I can just go and flit and do the odd 2 to 3 day courses just to enhance things. It's not about that. It's about that fundamental knowledge, whether for me, it's obviously the permanent makeup world, for you, it's the aesthetics world, the medical safety side. So it's not about just, oh, nobody can't do it. You have to be this, you have to be that. You have to have the underlying knowledge to be able to keep your clients safe ultimately, don't you? So obviously looking for qualifications is one. For me, from a client point of view, when I'm looking for an aesthetic practitioner, Bethany, I chose you because all your clients didn't look like scary crows. I mean, and when I mean that, I mean frozen, like, I can't explain that scary look and the blown up lips, and high cheekbones and all those awful things. So for me, when I'm looking for an aesthetic practitioner, definitely I'm looking for people my age, perimenopausal,
Yeah,
natural looking. And that's where all your pictures are just stunningly, enhancingly beautiful. I will happily say it. Your
oh,
work's just, it is. It's just, and there's a woman, that's all you want. And you've hit the nail on the head earlier on when you said about building people's confidence, just naturally listening to what they want. So for me, you have to find someone you resonate with. And definitely you can tell from your social media, from your marketing material, from your phone calls that you do, from your messaging, everything. It is about empowering women in a natural, safe way.
definitely. Thank you for that, and I'm glad that comes across too. But I do think, yeah, when I say as well, like sorry, what you said about pictures, if people, I've had patients before where they come in, they want really big lips, and I'll show them some photos and say, okay, would this be an acceptable outcome for you? And they're like, no, I want them way bigger than that. And I'll show them kind of maybe the bigger end of lips that I would do. And they're like, no, no, I want them much bigger. And they'll show me what they want. And because I'll often do that and show pictures and confirm that what natural is to me is the same to you and that we're both on the same visual page. And I will say to those patients, no, like, no, because I don't want that to be representing my work. However, I have nothing against people if that's how somebody wants to look for themselves, but they need to find a clinician where that is the look that clinician does day in, day out. Because if you're looking at somebody's social media or website, deciding whether to go to them for treatment, it's if they have some that look a bit unnatural, some that look really natural, and how are you supposed to know whether that was intentional or are they going to accidentally make you look like that? So for me, I will only ever do natural treatments. And if you've got some massive lips and you want to keep them, that's absolutely fine. But I will not be putting any product in there to maintain that for you.
Yeah.
Doesn't mean you can't go somewhere else for it. The same as like when hairdressers say, well, no, I'm not going to bleach your whole head repeatedly because your hair might fall out. Fine if you want peroxide hair, fine if somebody else will say yes, but that won't be me. So checking that your values align with that clinician as well. And I'd also want to know about maintenance and aftercare and what their long-term vision is for you as a patient. My philosophy in the clinic, like my method, is prevent, regenerate, maintain. So it's a 3-step philosophy where we will prevent further damage, whether that's just SPF in your 20s or maybe more advanced in-clinic treatments. The regenerate phase, which is replacing lost volume, boosting your collagen levels, restoring those tissues to be functionally optimally. It's a tongue twister day today, isn't it? Functioning optimally. And then your maintenance phase. And to me, that's one of the most important parts of keeping results looking natural is how you maintain them. So not just more, more, more. Patients will come and say, oh, I think I've been somewhere else and oh, I'm due my 6 month top up of filler. And actually I'll say, well, all the filler's still there. We don't need to just do more. And a lot of clinicians will just take your money. And I always say to my patients, I'm happy for you to invest, but not waste. And I would rather do nothing than the wrong thing. So if you're not ready for that product, if there's no benefit cosmetically, we're not going to do it for the sake of it. So checking wherever you're going is going to consider your long-term results. It's not just a conveyor belt of treat you and off you go. We're really thinking how are we going to keep you looking your best for many years to come. And if you've got any concerns out of hours after treatment, what's the response going to be like? Who's looking after you and what's the plan that's in place?
Yeah, I can 100% say your aftercare is absolutely amazing. And the knowledge yes, I've had Botox and fillers, for years. And the aftercare, the messages, the emails, the checking-ins, they're all just brilliant, absolutely fantastic. And the skincare products that I'm using to obviously maintain my gentle new appearance
Amazing.
is
Oh, do you like
fantastic.
your products?
Yeah, they are absolutely fantastic. I may have to buy some more soon because I've been using them. So obviously I talk about perimenopause all the time because obviously I am of that age. So I'm guessing you get lots of perimenopausal women coming into the clinic. What, generally speaking, are most of their concerns?
So loads of women, I know people can't see the video form of this, but they will come and hold their cheeks and push them up and say, I just want to be lifted. It's all sagging down.
That was me.
Yeah, everybody just goes, I just want this lift. And sadly, a surgical facelift is the only true lift. However, we know that the same kind of things happen to everyone as they age. We lose, our skull gets smaller, the fat that supports our skin shrinks away in most areas, and the skin becomes less elastic, less springy. So it's a bit like the table's got smaller, but the tablecloth's got bigger. So we've got this loose skin and everything's being pulled down by gravity. So I hear the same concerns, this flattening of the cheek, hollow under eyes and eye bags, jowls forming, feeling like the jaw blends into the neck. So everything traveling south, making us look more square. Also, a lot of ladies say, oh, people keep asking me what's wrong, or why do I look angry, or why do I look sad? And again, it's this downward slide of the facial features, giving that aesthetic outcome. So a lot of the time, my treatment plans target all the different layers. So we will try and put back that lost volume, tighten the skin, and we can use treatments like Botox to relax muscles that are pulling down to help things bounce back up a little bit. So really common concerns with very similar treatment patterns, but they'll often have different impacts on ladies, throughout their life. Some will say it's at work. People are commenting on how they look. Sometimes they look in the mirror and see, I look in the mirror and I look like my grandma or whatever. And it's interesting because it seems that the outside, their appearance doesn't match their sense of self and what they expect to see when they look in the mirror. And when we can align that, that really boosts confidence and empowers my lovely patients.
It definitely is. I would definitely say, so I'm 46. I would only say it's been these past few years where I've caught myself in the mirror and sometimes don't recognize myself. And it is, and all of a sudden, as soon as you hit that perimenopause and your hormones change, and obviously estrogen drops, everything, my skin texture, open pores more, just that general dull, sad looking. It is sad. You do look sad. You look like you're Mardy all the time because everything does drop. It really, really, really does. So we're talking about me. So I'm happy for my clients to know what treatments I've had. I've had some amazing treatments, but I will say the wrong words because I'll say, I've had this, I've had this. You go, no, Jodie, you had this, darling. So we just let everybody know the treatments that I've we let everybody know the treatments I've had and what they are, because especially the and I can't say this word, is it Profilo?
Yes, you did
Yeah.
it.
Why? I know why I've had it done, but I want my clients to know about it because everyone knows what Botox is called. Everyone knows what fillers is called, but not everybody knows about that. And I had to have an education on that. Over to you.
Absolutely. Thank you. So it's been so nice treating you because you've got perfect expectations. You understand when I'm explaining things, you really take it on board. It's been so nice being able to treat you. So obviously, like you said, we've done some Botox to just smooth the forehead, open up the eyes, make you look really refreshed. Then we did some filler in the temples, which is a really overlooked area. So the temples, the area next to the eyebrow, where we get some hollowing with age, and that can mean the tail of the brow sinks down slightly, the face looks a little bit more concave in that area, narrows the top of the face, which can make you look older. So we've just rejuvenated that slightly. So natural, no one would notice that treatment, but it gives that support to the brow. And then, like you said, the Profilo, which is really the magic sprinkle, is a gel which is made of hyaluronic acid, which is the same as what fillers are made out of, but it isn't stuck together. So when we inject it into the skin, it spreads out like an injectable moisturizer. It attracts moisture to the area. It hydrates the skin, making it really bouncy and glowy. So you get short term, very quickly you start to see that change in the glow. But long term, from maintaining it, it acts like a message to your skin cells, so they make more collagen. So you get this boost of collagen being produced by the skin cells. Through menopausal years, that starts to plummet, and we're fighting back by keeping reminding those skin cells what they're supposed to be doing. So it really helps you sustain your collagen levels rather than them depleting. So it slows down the damage.
Yeah, I have definitely noticed a difference. I've had 2 treatments now, and yeah, I just feel so much better in myself when I look in the mirror and I don't think I look like say, your grandma or your mum, and you think, oh, crikey, who's that person staring back at you? And I've had so many compliments about how good I'm looking. So I'm like, yeah, I can't take all the credit.
Thank you.
So thank you so much. So hopefully my listeners and my clients have got lots of insightful information. I will be popping your details below because I know you are open to talking to people about any questions that they've got, any concerns or anything like that, or I know lots of people, if they live in Ireland, for example, and they can't obviously come over to you, I'm sure you would be able to. I've just randomly picked Ireland, but we'll be able to find them a good aesthetic practitioner between us. So the light-hearted side of Get Your Sparkle on, the reason I decided to do this podcast was to talk about perimenopause and the things that we can do to help, like Botox fillers and definitely Profilo, but also just to make people smile and empower women. So do you have like a little funny story or a memorable story that you're happy to share with us that's not too risque?
Yeah, so it's quite well, this one's a funny one actually. I was once wanting to try a new pattern for Botox to do with the jaw clenching, because like jawline slimming, so you can slim the appearance of the jaw by injecting the muscle at the back that clenches. And I couldn't quite see that well what I was doing, and I was doing it on myself. And I thought, I'm just going to try out this new technique, and obviously it takes 2 weeks to kick in. So my little boy wasn't very well 2 weeks later, and I'd gone a bit too high up, and touch wood, never had an adverse outcome with a patient for Botox. I stopped tracking after over 1,000 treatments, never any problems. Obviously, the first one was on myself, the only one, and I'd got a really lopsided smile. So when I tried to smile, I'd caught the muscle that pulls your smile out. So my smile was like really, really uneven, and my mum went, oh my gosh, I think all the stress with Archie being poorly, you've got Bell's palsy. And I was like, no, I've just got botched Botox that I did to myself. So I had this really strange, like single-sided smile for ages. And fortunately, I've never had a problem with a patient. It's only ever been on myself. But mum was like, oh, you might need to get some help. I think you've got Bell's palsy. I said no.
Oh,
I
bless
just
you.
need to get someone to
At least you made the mistake on you. I've done that. I've been really, really busy in the salon, and I'm like, I really need to sort my eyebrows out. I didn't have time to wait for anybody, so I thought, I'll wax my own eyebrows, wax the whole tail off.
Oh. I mean, the things we do.
Luckily, my eyebrows are tattooed underneath. So,
yeah, you waxed off and it was still there.
Yeah, thank God, luckily. The only benefits. So thank you so much for your time. That is such a full of amazing information on what things to look for when you're looking for an aesthetics practitioner, and it's been an absolute pleasure. So hopefully we will catch up soon. So to all my lovely listeners, thank you so much. Have an amazing week and keep your sparkle on.